Okay, and here we are for part two, the final portion of the abnormal cytology in the 21 to 29-year-old. Sorry to leave you hanging on the last set, but the question we left off was what's next for Beth? Here she has an ASCUS result on her cytology report on her Pap test. So the hint here is we're going to go to figure 5 on page S10 of the guidelines. So go ahead and answer the test question. Okay, so hopefully you got this right. Women who were age 21 to 24 with an ASCUS, we're simply going to repeat the cytology in 12 months. Now, I would like to point out here, oops, I've got my screen kind of in the way here, that for younger people in this age range, the 21-year-olds, it is possible that they would get basically 3 ASCUS results in a row before they refer for a colposcopy. Beth is going to age off of this chart that you see here, but you have the initial ASCUS, repeat it a Pap only in 12 months, and then according to the diagram, if that is still ASCUS, you're just going to go ahead and repeat again in 12 months, just the Pap only. So in 2 years' time, there'll be 3 ASCUS PAPs. There'll be the initial one, today's date, a year later, an ASCUS, and then a third ASCUS 2 years from the initial ASCUS. So, and the next step after that would be referral for a colposcopy if it's ASCUS or greater, as you see here. You're going to go to colposcopy. So, but for Beth, she'll actually age off this, like I said, and if she doesn't go back to normal, let's hope for that. There's a high chance of that. Okay. So here is our next chart. It's a year later. We're simply repeating the PAP 1 year later for the ASCUS. And, you know, looking at this chart, this is the standard, not the special population chart for women with ASCUS. And if she's getting this PAP done at 25, this repeat cytology, if it's negative, she'll go back to routine screening. If it's ASCUS here, because of her age, being 25 now, she'll go back, she'll be referred for a colposcopy. So that is a big difference between the 21 to 24-year-old age bracket and the 25 to 29 is they go to colposcopy quicker. That's the main point I'd like to make on this one. Okay, and here's one last case scenario. This time, this is Maggie. She's a 29-year-old pregnant woman, and her Pap has just come back with a low-grade squamous interepithelial lesion. And pregnancy is considered a special population, and I just want to show you that here, the preferred thing to do is to send a pregnant woman with a low-grade lesion straight to colposcopy. As the alternative, this is acceptable to defer the colposcopy and wait till 6 weeks postpartum, but it's preferred to go straight to colposcopy. So just keep in mind that a pregnancy is a special population. So thanks so much for participating in these case studies. I hope it's really helpful in helping you learn how to pull out these guidelines and utilize them so they're not so confusing. But I hope it's been helpful. Have a great day.